right. Hello, everybody, and thank you for joining us on this special enrollment webinar today, February 4th, 2025. I'm very excited. This is a topic that is near and dear to my heart. Got a lot of enrollment assisters on today, which is excellent. I think you guys know open enrollment can be really intense. It can be draining, it can be fun, it could be all the different things. But the rest of the year is kind of when we have to put our thinking caps on and really figure out how to get people into the marketplace. Look at the different situations as they come to us. And it really behooves us to know all the ins and outs, all the ways that people can access the marketplace. And I'll say I don't know all of them because I look every time I prepare this presentation, I learn new things. I'm pleasantly surprised to find new information out there. And there are navigators and CACs on this call right now who meet with more consumers than I do these days and probably accessed some really interesting special enrollment periods last week. So I'm hoping that we can do this in a slightly interactive way as we go. That was the choice to run this as a giant meeting instead of a webinar. One, I like seeing your faces and having people to play off of. But two, there's a lot of expertise amongst the Navigator and CAC community of Wisconsin, and I wouldn't want to deny anybody that expertise because there could be something again that somebody accessed last week or during open enrollment, things like that, and they could jump in and really that might be the one piece of wisdom or information you need to help a consumer tomorrow or next week or later this year when you remember this. So I will say, I said it before, but let's have it on the recording for posterity. I have a very finicky mouse wheel, so I'm going to keep my hands off the mouse as much as possible. But I am joined today by Elizabeth Rothy. She's our workforce and affiliates liaison slash privacy and security officer. She is going to help me go ahead and monitor the chat. You guys are, oh, I will say, you guys are doing a great job muting yourselves on entry. That's pretty good. That was the one gamble with running it as a giant meeting. So thank you for that. But Elizabeth, I'm going to kind of leave it to you to determine if there's a show-stopping question, anything like that. People can go ahead. We're not using a Q&A. We're going to use the chat. So if you have something either that is worth, there we go, sharing, whether it's an anecdote or, hey, this is my experience with this special enrollment period, or, hey, that didn't make a lot of sense to me, please throw it in the chat. Again, this is going to be very interactive if you guys want it to be. And we can stop throughout if we need to. So we're going to talk core concepts, just basic special enrollment, just review, kind of level set, get everybody on the same page. So some really basic special enrollment periods, the things we access every time we help consumers. Some less common ones, although I will put a caveat on that some of those are becoming more and more common, regrettably in some cases, and we can get into that. We'll have an example that allows us to get a little bit creative and talk about some of the other factors that we have to consider when looking at special enrollment periods. We'll zoom out to talk about some policy stuff at a pretty high level. And then really, we want to get to that discussion where I would love to hear from people, hear your experiences, hear your tips and tricks, things that work for you, especially if you have any really interesting ones. I think we all, as enrollment sisters, if you do this even for a year, you end up with one that you're just really proud of yourself for navigating successfully, where the consumer had lost hope, didn't know what their options were, and even you had to look something up and talk to a marketplace representative, and it finally fell into place, and that person was able to get coverage. So that's the kind of experiences that we want to talk about today. So some core concepts. I see that we have a lot of veteran enrollment assisters on here today, which is excellent. So I don't need to go over this part in too much detail, which is really nice. Basically, you guys know what a special enrollment period is. If you don't, I'm surprised that you'd be here, but we can talk about it a little bit. Basically, special enrollment period, for the purpose of this discussion, is an event, an occurrence, some circumstance that is allowing somebody to get access to marketplace coverage, typically with tax credits. When they wouldn't have otherwise. So outside of open enrollment, special enrollment period, this is kind of what we do the rest of the year. We won't be talking about things like special enrollment periods, obviously for Medicare, because that's not where we live. And also things like special enrollment periods for work don't really apply here. This is a marketplace focused training. If there can be an interplay between those things, especially in a complicated household. So if we have a question that goes there, we can absolutely talk about it. But for the most part, this is marketplace special enrollment periods. Talking about minimum essential coverage, because MEC is going to come up a lot. A lot of the special enrollment periods we'll talk about have either always or had added over the years this requirement that people have existing coverage. And that coverage has to meet the minimum standards set by the Affordable Care Act. So when I'm working with consumers, I always tell people minimum essential coverage is what you think of when you think of health insurance. And that has always served me very well as a shorthand for describing, you know, essential health benefits and things like that. It's like, okay, this is covering all of your basic, doctor visits, medications, emergency room, mental health, all those things, the things that are set out by the ACA. We will talk a little bit about some things that aren't MEC and how they interact with special enrollment periods, because there's an interesting category that consumers sometimes very unfortunately find themselves falling into because of those programs. We'll get to that. That I think doubled as a nice explanation of the requirement of prior coverage. Just a lot of the special enrollment periods do require that you have already had coverage. It wasn't like that in the beginning, but in the last, I've been doing this for a while. In the last 6, 7 years, more and more of the special enrollment periods require you have prior coverage. It's rare that they don't. Attestation versus verification. Um, we have been in kind of a nice period. Honestly, one of the very few positive things that came out of the pandemic was some making more lax some of the rules around attestation and verification. So we seem to still be in that period. It could change. But when I say attestation versus verification, I mean, when you go to access a special enrollment period, or when a consumer says, hey, I lost coverage, is the application saying, hey, I'm taking you at your word? That's an attestation. Go ahead and apply. Or verification is saying, nope, we want proof. Go ahead and submit that once you're done with your application. We have been, like I said, in a nice period where attestation has been accepted more and more. I don't know if that's going to change, but it makes things a lot easier for the consumer, because it means not tracking down documents. It means less of a headache, and it's you don't forget that. I mean, I think a lot of consumers also the application, I think we've all seen too, sometimes just doesn't work right when you go to submit a verification. So we prefer attestation to verification, folks. Advanced availability and regular coverage dates versus accelerated effective dates kind of go together. Advanced availability speaks to when you can access a special enrollment period before you actually have that event. Typically, this is what we want. We know someone's going to lose coverage, and before they do, they come to an assister or they apply on their own, and they're able to get into the marketplace, and then they don't have a gap in coverage. Similarly to the concept of regular coverage dates versus the accelerated effective dates, very few plans allow people to start, very few situations, one major one really only, allow people to start their coverage mid-month. But typically, if you act early enough, you can get the special enrollment period, to start coverage the first of the next month, right after they've lost coverage. There are a couple circumstances we'll talk about where if somebody is losing coverage, there can be an overlap, and they can avoid a gap in coverage that way. And then lastly, we'll talk about limitations on plan selection here. A lot of, and this kind of goes hand in hand with the requirement of having coverage, a lot of the special enrollment periods require people to stay within that same metal tier. And I would say this doesn't come up as much in conversation with consumers throughout the year as it does during open enrollment. When people are coming to you and they're saying, this is my circumstance, this is what my income is like, I may have a change, I currently have job-based coverage, this is what's happening. When people are selecting that metal level for themselves, for their families, just knowing that, hey, you might be locked into that meta level. I think we see a lot of, discussion around that during open enrollment when people are trying to think ahead, because a lot of times that bronze plan, especially if it's $0, can be really appealing. It can really draw consumers in, but knowing that they might need or prefer a silver or a gold plan if their level of care rises, maybe it's a health concern that's triggering them to think I need a different one. But being locked into that meta level does apply to a lot of special enrollment periods. So just keeping that in mind. We're going to talk two resources right off the bat. If my previous SEP trainings I've done, I've definitely referred to this one. And this is one that I hope everyone is familiar with. And if you're not, I am excited to introduce you to it today. Health Reform Beyond the Basics remains an excellent wealth of information and resources for enrollment assisters. You'll see a screenshot there, screen grab of their special enrollment chart. And I've linked up their special enrollment chart, at least the short one, which is a really good quick look at the different special enrollment periods. I would say even more useful for this group is the longer one that allows people to it looks at this level of detail you'll see on the screen where it really goes into the plan selection limitations. Am I limited to that same metal tier? When are the coverage effective dates? And then what I think is the most useful for us in thinking about this work is that fine print. Like the one I have as an example here is the unwinding step, which obviously is no longer a thing, but there was a lot of nuance to that discussion, and having that in a table that was easy to check was really useful last year. The charts that Health Form Beyond the Basics remain useful, as does the rest of their website, their resources, and the different videos. And though they are doing fewer webinars, that they remain one of the best resources enrollment assisters can access to date. Next, I want to say healthcare.gov is a really, really, really good resource. It's not something that I expected to say it's not something I think about as often as I should. Because I think of healthcare.gov first for enrolling consumers. But every time I look at it, every time I need a new piece of information, especially when I'm preparing a training like this one, I go onto the site and I see a lot of improvements. They do a nice job keeping the glossary up to date, keeping the different pages, the language on them easy to understand. I would say it's not perfect for consumers. I think the concepts are still very, hard for the average person who doesn't swim in health insurance the way we do to understand. But for us, they're perfect. Like for enrollment assisters, for CACs, navigators, agents, brokers, they're the exact language we need. And it's really just like one degree away from something that we can easily share with consumers. Their SEP page is great. The glossary is a phenomenal resource. And then one thing that comes up a lot, and we'll talk just a little about immigration statuses today, but they have a page where it's like, okay, somebody's presented to me with an immigration status and I need to know if it's one of the ones that qualify. Their page on it is actually very, very good. So I don't want to sell healthcare.gov short. It is more than just an enrollment tool, and there's a lot of really great information there. And I just wanted to front load that into the presentation because normally when I see presentation and resources are at the end, I don't remember them. So I just want you guys to be thinking Health Reform Beyond the Basics and healthcare.gov as useful functional resources for you when you're working with consumers. Don't be afraid to look something up. Don't be afraid to verify. And if you can find it in healthcare.gov, great. That is always one of the most reassuring feelings when helping a consumer. It's like I can find the exact language I'm looking for, and this is exactly what I need to tell the consumer. There's nothing really beats that when you have a question on a special enrollment period or any matter of policy. Any questions so far? And I can't easily scroll between the two things. Any questions or anything like that, Elizabeth?
There was just one question asking if the recording will be emailed out or on the website afterwards.
I'll say what I usually say. If it's any good, we'll email it out. If it's not good, you'll never see it again. No, it could probably live in both places, honestly. But yes, the plan would be to email it out with the slides. And then the only thing is the recording will probably be the presentation. I don't think we will record the discussion at the end. So I don't want people to feel like they're going to be recorded for, until the end of time as part of this presentation. We can have a very free and open discussion at the very end.
Absolutely.
Yep. All right. I'm just going to click and stay away from the mouse wheel. All right. So special enrollment 101. Basically, this is what we see most often. This is kind of the easy stuff, right? This is what we, I don't hope to see somebody losing coverage, but when it comes to helping them apply, helping them access the marketplace, losing minimum essential coverage is the most basic form of what we do. This is we saw, I mean, how much of this did we see? We saw so much of this last year with the unwinding around Badger Care Plus renewals. A lot of people, I think 70% managed to stay, with their Badger Care Medicaid coverage, but that means a lot of people ended up going to the marketplace, and we saw them again during open enrollment. But when somebody goes to renew their Badger Care, or somebody loses a job, their job-based insurance, whether it's maybe through their parents or spouse themselves, or student health insurance. And we'll talk a lot about COBRA later. But basically, if you have had minimum essential coverage and you're losing it, or you have lost it, you will have a special enrollment period. You'll have 60 days or 90 days in the case if it's Medicaid. Typically, the best thing is if people can find us as early as possible to avoid that gap in coverage. That's really, really what we want, is that if somebody's going to lose coverage, they know about us, they know where to go for help, they can find you as a CAC or a navigator, and then it makes it very easy, because then we can say, okay, yes, you can go to the marketplace, you can access special enrollment period, here's your tax credit. Um, the most complex part of this is if you end up needing another special enrollment period. So having existing coverage, not necessarily losing it, is really important for these other special enrollment periods that we'll talk about. There's quite a range of them, and they really define our work, and our ability to help a consumer access them is what makes what we do. I honestly, I think, pretty cool, because most people wouldn't know. Just remembering that you are in a privileged position, because people do not know how this works or how it's supposed to. So just don't take your own knowledge for granted. Even if you have to look something up or contact somebody, another more senior assister or navigator, just know that you're in a privileged position to help people, because this is complicated stuff. The low income special enrollment period, this went into effect in March 2022. And I, again, while working on this, was reminded that this is technically only available through the 2025 plan year, unless it's extended by an act of Congress. So thinking of this as sort of tied to those, it's not directly tied to, but in the same category as the increased tax credits. There's a lot of things that need to happen this year to make the marketplace continue to be accessible and affordable for people. But if somebody's income drops to 150% of federal poverty level or lower, and they're eligible for APTCs, so but for Wisconsin, we're talking 100 to 150, then they can apply at any time. And I think of this, there's another one that we'll talk about in a little bit, where if people's income is fluctuating around the limits for Medicaid, fluctuating around the limits for tax credits, one way or the other, you can probably get them a special enrollment period. That's typically, like, rather than memorizing everything that's on your screen, rather than memorizing everything part of the discussion, if people's income is at that level and it's fluctuating, you can probably, at least as of right now, find them a special enrollment period. In this case, it's got its added bonus of you can apply at any time. It's driving me crazy. Without another qualifying life event or loss of minimum essential coverage. And you can switch to a silver plan if you're not already on one. So again, if somebody's income is fluctuating around those levels, then they have the advantage that those plan limitations might not come into play. There's actually another one where it's newly eligible for cost sharing reduction we'll look at. Or we could just talk about it now. If somebody is newly eligible for cost sharing reductions, it allows somebody to shift to a silver plan if they're not already enrolled in one. That is a distinction that I think is lost a lot of the time, because people will come to us during, again, open enrollment, and they'll be planning for the year and saying, what if my income changes? If somebody becomes eligible for cost sharing reductions, they can switch to a silver plan. I don't see that discussed a lot, but it is absolutely enshrined in Marketplace healthcare.gov website, and it's something somebody can do. So other common special enrollment periods. So moving, they have to change their county. Typically, you'll see a change in zip code corresponding with that, because you guys know, everything in terms of where somebody's plans are is determined by that zip code. Change in household size. You've got your typical ones we see most often are probably birth and divorce, at least the ones I see most often. But birth, adoption, marriage, divorce, or death can all come into play and give somebody a special enrollment period. Remembering that birth is probably, it's one of the few times that you can get a marketplace plan to backdate to cover that child. Somebody changes to an eligible immigration status. You'll be able to see when we send these slides out that page I linked up earlier with all the different marketplace eligible immigration statuses. And then, of course, release from incarceration or jail will allow somebody to access the marketplace. All right. How are we doing? Any questions so far? I'm hesitant to look because the mouse wheel thing.
Yeah, no, you're great.
All right, sounds good. Forgive me while I have some of this tea because I have been sick. All right, so I mentioned this one on the previous slide when I was talking about the income going up and newly eligible for tax credits moving out of the Medicaid coverage gap. So typically, this is what I mean. If the other side of the coin from that one, if your income is dropping below 150% of the poverty level, if your income is going above 100% of the poverty level, you can also get a special enrollment period that way. Now, the interesting thing about this one is we don't see it that often. I think it's kind of rare in that when you see the situation, you're more likely to see somebody who is actually enrolled in Medicaid already and losing their Medicaid coverage as a result. But it is important to know that maybe somebody, either they didn't have Medicaid coverage or something else made them ineligible, but their income is fluctuating around that level. If they're going the other way, kind of into and out of that Medicaid coverage gap, then they can get a special enrollment period that way. So just be aware. This is where I say the shorthand for this is if they're fluctuating around those income levels, I want people to remember that there's probably a special enrollment period. And in most cases, the marketplace website is going to recognize those. All right. So move on to something a little bit more sensitive is the special enrollment period for somebody who is a survivor of domestic abuse or violence or spousal abandonment. This is a tricky one, not necessarily to access, but to talk about, to work with the consumer, and to know what to do. Because typically, when we are doing our applications with consumers, we know that we have to answer those questions correctly. And married filing jointly kind of springs to mind as if somebody's married, they have to file jointly, and we have to put that down. Know in your head and heart that this is the exception to that rule. If you have somebody who is or says they are a survivor of domestic abuse or violence or spousal abandonment, they are allowed to go into a health plan that is separate from that person, and their dependents are probably eligible too. And when they fill out that application, they can answer unmarried instead of married, even though everything in this application will say not to do that. That is absolutely the rule. You can find it on healthcare.gov. You can get it confirmed at the federal level. They can absolutely put unmarried on that application. There is a requirement of prior coverage, sadly, so they will have had to have had other coverage. But oftentimes, what you'll see in a situation like this is they're trying to get off of the other person's coverage, the abuser or abandoner's coverage, and they're trying to get their own. So there is no limit on the plan selection in terms of things like meta level. These, I would say, you can apply at any time. It gets a little tricky, but the marketplace, from my experience in doing a few of these, is not in the business of telling people no, that abuse didn't happen recent enough, or it's not still affecting you. These are delicate, complex situations, and I have yet to see them be restrictive in determining when somebody seeks out that special enrollment period, which is a good thing. Because again, these can be very difficult. They're very difficult to talk about, but fortunately, they're easy to navigate in terms of attesting. You just have to be willing to call the marketplace and say, hey, this is what's going on, and they can go ahead and trigger that special enrollment period for you. So unexpected situations, this is the marketplace's term. I would consider a lot of these situations unexpected, or any or all of them can be unexpected depending on the circumstance. But for this category, we'll see some of this where something has happened typically to stop someone from enrolling. We saw a lot of this during the pandemic, or at least this is when I really learned about these and how they work, because somebody would be hospitalized for COVID-19 and they couldn't access either the Marketplace website or an enrollment assister. Um, it could be another hospitalization. Somebody's incapacitated, and they can't enroll. So this could be because this could be at the end of an existing special enrollment period, or I actually did have one where I was advising somebody who was hospitalized towards the end of open enrollment this last year and saying like, okay, when that person is better and out of the hospital, they will be able to get a special enrollment period. They literally can't enroll right now, even though they would be eligible to. I think where they get a little bit grayer, I think that the first one's pretty straightforward, but where they get a little bit grayer is if somebody experiences a natural disaster. Typically, we have to see that as something designated by the Federal Emergency Management Agency. A surprising number of things do get classified as natural disasters. I've seen it happen. I think the most um, real example I can give is I had somebody who was unable to travel and their power was out because of a winter storm that was, I forget which year, but it stopped them from being able to apply for marketplace coverage. So that counted as a special enrollment period. Now it can be different things. I've got wildfires, coming to mind. Obviously not a problem here, but if somebody's traveling, maybe they can't. So look at what a person's telling you. When people come to us, they want to tell their stories. They want to say, this is what's going on with me. A lot of those things can and should trigger alarm bells for special enrollment periods. When somebody's telling their story, you should be thinking, okay, how does that relate to your ability to access the marketplace? Can we tell that story and get you the special enrollment period you're supposed to get? And then the event must have prevented you from enrolling during open enrollment or a qualifying special enrollment period. I think during when it can be a hard sell sometimes when it's, I've been out of the hospital for X days. There's not a limit on that, but I have had it work successfully where somebody has said, I have been out of the hospital for 10 days, but I've been waiting for an appointment with an enrollment assister to do this properly. Or especially if there is any sort of, a head injury or something cognitive in play here, where it's like, I want the professional help in applying that I am able to get through the Affordable Care Act. So just knowing that something prevented somebody from applying during open enrollment or during an existing special enrollment period, and then I would say get them to meet with you or act as soon as they can, but knowing that you may have to kind of tell that story a little bit. So for these and all the previous ones, you need to call the marketplace call center. You need to attest the situation. Sometimes it will require talking to a specialist, a tier 2 specialist or a supervisor. I have been finding that marketplace representatives, I don't know what their training process is like. I would like to. Sometimes they're very, very good. Sometimes they're very, very not. So just know that your experience may vary, but you can always escalate something the way you would with any other complicated situation in your professional or personal life. You can always ask for a supervisor or tier 2 specialist to look at these, and they might be the one to say, yes, that's a special enrollment period. All right. Okay. All right. American Indian or Alaskan Native. This is probably one of the, we get, I think, a lot of questions on this when we are training to be CACs and navigators, when we're renewing our credentials. This may be a population that you work with a lot. This is one of the, I think, cooler and more exciting variations of special enrollment period within the law, if I can say that, where these can be used anytime. There's no requirement to prior coverage. Verification, typically a document issued by a federally recognized tribe indicating somebody is a tribal member. That's typically what I've seen. But they can also have a document indicating their shareholder status in an Alaska Native or Village tribe. I have yet to see that personally. Typically for Wisconsin, we're thinking of tribal membership. But this is a very exciting category because these people, there's fewer barriers, right? We're looking at a population where there is very little preventing them from getting coverage. If they want it, if they can afford it, we can help them. And then remember that between 100 and 300% of the poverty level, consumers who are eligible for this special enrollment period can enroll in kind of their own version of a zero cost sharing plan. So they won't have out of pocket costs, deductibles, co-payments, co-insurance. So just knowing that, you know, the cost really shouldn't be the barrier for this particular population. But I think knowledge is a big one. People have to know that this is an option. They have to know the marketplace exists. They have to know that it's safe, and that's where the outreach and education that navigators and CACs do really comes into play when making sure that the people who are eligible for the American Indian Alaska Native Special Enrollment Period are taking advantage of it, are using it, and then honestly, this is one of the cool things. You could switch. They can switch their plans. So, if they are not happy with a provider, if they're not happy with a network, not everybody has that ability throughout the year. Um, but certainly, if they're seeking treatment for a specific condition and they're looking for the right provider, the right fit, encourage them to do so and continue to help them as they kind of go on that journey. So we're still technically in the less common special enrollment period section, although I have got to say this one is not as less common as I would like. This category used to be something that I could proudly describe as something that was fairly niche in Wisconsin, something that I had, kind of great success with as kind of a one-off situation where I saw fraud or misrepresentation and I was able to help that consumer. Now I don't know of a navigator in at least covering Wisconsin that hasn't had to engage with fraud or misrepresentation at some point. Um, I mean, and please, if you want to jump into chat and say yes, this is something I've had to deal with in the last year, please do so, especially outside of covering Wisconsin. I'm really curious if it is as prevalent as it seems to be from where we sit. I was on some of you know this already, but I was on a call with a marketplace representative who said that 70% of the people that call her have some element of fraud or misrepresentation on their accounts. That number seemed shockingly high to me. But then if you look at the way the last two open enrollment periods played out, this one, last one especially, I think everybody encountered it in some way, shape, or form. So while this is still in the uncommon special enrollment period section, it is far too common for my taste. The important takeaway and thing I want people to remember today is that there are remedies in the form of things we can do for that person, for their account, and getting them a special enrollment to get coverage when that actually works for them, that they need. So misrepresentation, a lot of time we're calling it fraudulent enrollment now. You might hear the words bad actors being thrown around. I'm happy to throw the words bad actor around because there are a lot of bad actors out there. They're doing a bad thing, taking advantage of people. These are often used, or often we identify them following open enrollment, because people will go to use their coverage and realize that it's not what they expected. And this changed forms a bit in the past few years, because what I used to see was people would go and what their plan wouldn't have been a marketplace plan at all. It would be something that looks like insurance, but is actually a short-term plan, just kind of a bad product that was marketed to them or sold to them as insurance. Now we see people who are, on $0 bronze plans without their knowledge. Somebody signed them up at some point, and because the premium was $0, they had no idea. Or somebody who is on Medicaid and had no idea that somebody also signed them up for Marketplace at some point in time until they go to use their coverage. I've had provider networks, reach out to our navigators. I had a provider reach out to me last week and saying like, hey, are you seeing this with this particular health plan? The short answer is yes. And it's very unfortunate that these are happening or that people are finding out about these when they go to use their coverage, when they actually go to get care. For the purposes of our discussion today, just knowing misrepresentation is still very broadly defined. I think I kind of gave you a taste of the different flavors and versions of it that we can see, or that we are seeing most commonly now. But it can include somebody, again, enrolling in a marketplace plan that doesn't meet their needs. That's probably what we're seeing the most of. It could be a provider network that just doesn't have providers in their area. So we see that sometimes in rural Wisconsin. or enrolling them in a plan or product that doesn't meet minimum essential coverage. That's what it used to be. That's what I used to see the most of is, hey, I got this plan and it walks, talks, and looks like health insurance, but it has a maximum or doesn't cover pre-existing conditions, and just big red flags that are hidden from consumers when these people are selling them these plans. So those situations all count as misrepresentation, where somebody has effectively defrauded a consumer and tricked them into enrolling something they shouldn't have. Um, it is easy enough to get a special enrollment period for these. It can be done over the phone with the marketplace, typically just explaining the situation. I'm curious, and I'll certainly open it up to the chat or discussion. I'm curious if people have had any lack of success here. I don't think I've ever had them not take me or the consumer at their word. It helps, or I usually have the name of the agent or bad actor that kind of steered the consumer wrong, or at least some kind of timeline of events. But has anybody on this call tried or seen a fraud or misrepresentation and then had the marketplace not open up a special enrollment period? Anybody? I don't see anything in chat. I'm just really curious. I'm not gonna. We don't need to stop and linger on it. But just as I'm speaking and thinking about this, typically, I would say that that's a good thing that they're taking the attestation, right? I always go into those with as much information as I possibly can, because I also want to hold the agent or bad actor accountable, right? And you can do that through OCI and through the marketplace. But really, for this training and for that consumer, it's about getting them off of the bad plan and onto good coverage. There can be, tax consequences if somebody was duly enrolled or enrolled in something they weren't aware of, and they have to reconcile their taxes later. But for the short term, you can get them a special enrollment period and you can get them onto other coverage. The effective date may vary. I have seen it backdate. Typically, it's easier and easier on the consumer if it's just, okay, we've identified the problem, let's fix it starting the first of the next month. But I have seen ones where it has been a consumer who was defrauded and ended up with astronomical bills because they were in a plan that wasn't right for them. They didn't understand and didn't have any idea that it should have covered things, in which case I had to do an appeal, but it was successful and we were able to get those bills covered. So the range on these goes from very simple, I can fix this starting the first of next month, to maybe we need to do an appeal here. We can fix it. I don't know what the outcome's going to be. Errors and mistakes. This is another kind of that more broad marketplace terminology. There could be a technical error with the marketplace website that's preventing consumer from enrolling or preventing their health plan from getting the information. Um, it can be difficult to identify and to prove that. So that's what makes these a little tricky. It can be hard to prove a technical error on the marketplace website. I want to tell assisters today, navigators and CACs, really, I think people bring this up a lot towards the start of an open enrollment period. Sometimes the marketplace does some wacky things. I think we've all seen it. I think we've seen the marketplace. It'll say, here's your tax credit. And then we'll go, oh, let me change one thing. And it shouldn't have changed the tax credit, but it presents different information. Another one that I would say is a technical error that could be overlooked if you're not thinking of using it in this way. But if a consumer says, hey, I enrolled in this plan because it says this doctor's covered, and we know as assisters that the marketplace website often has errors in those provider networks and oftentimes gives the wrong information about the doctors. You can say that's a technical error on the marketplace website. This is where assisters are probably thinking, I one protect people's PII. I'm gonna qualify that and say that, but there are a lot of pages with the marketplace where if you need to prove something, like, hey, a doctor isn't covered, or saying it is covered and it's not, something like that, make sure that either you are thinking screenshot or you have the consumer who is savvy enough to take a screenshot, because you don't, it can be otherwise very hard to prove these. And these are where I think attestation they're a little bit more suspect of it than some of the previous ones. I just that's a little bit of a gut feeling because I don't see this. This isn't the special enrollment period that I need the most often. But if you have the receipts, right? If you have the proof, if you have a screenshot, especially like a network issue or a price issue, if somebody says I signed up for this and then I got charged this, that can get them a special enrollment period. Now, mistakes. This is, hopefully uncommon. I would hopefully very uncommon. But I've asked this in previous years, and I've asked, hey, have any navigators or assisters on this call used the special enrollment period to say, hey, I made a mistake on this person's application, and were there any consequences? And the answers I've always gotten are, yes, it happens, right? We're only human. And in those cases, that person can get a special enrollment period. Um, it helps. I mean, as a navigator, you can attest. You can say, hey, yeah, I screwed up. I made that mistake. I told them this. I'm an expert. I'm licensed. I should have done this, and it should get that person a special enrollment period. That is a gray area that I have not really ventured into much myself. But I will say that people have said, yes, it works. And also, my follow-up question to that was, are there any consequences, in terms of certification or licensing for saying, I made a mistake, I screwed up? And for the most part, I have yet to see, not even for the most part, I have yet to see anyone have any negative ramifications for admitting that they made an error. So if you did make a mistake, it could be the difference between the consumer having the coverage that they wanted and maybe didn't explain super well, or you hit the wrong button or something like that, or more likely perhaps for the people on this training, it's cleaning up somebody else's mistake. I'll say that you oftentimes, I mean, we see that a lot where people come to us and maybe I worked with somebody in the past, maybe I didn't, and I see a name of somebody I don't recognize as their sister, and it created a lot of complications on the application, and we had to fix it. Those would be mistakes. Oftentimes, those are bundled with maybe there's fraud and misrepresentation, maybe there's errors, but honestly, it could be an honest mistake, and that should give a special enrollment as well. Oh, there it goes. All right. Elizabeth, is that a long question I see?
It is. Um, this person is wondering how to trigger an unaffordability step when their work insurance is almost double the affordability calculation.
Oh, interesting. Um, Tried twice, but can't get the ABC to trigger. And Steph, I so my first thought on that is that that's one that the site should do successfully and correctly. And I'm assuming that that I'm going to read through this real quick. Or through the application can't see a way to get it triggered. I would call. At that point, I would call. Yeah. That is one that you're right, and that just by your story here, it should work correctly. I don't know if there's something kind of flagging on the back end related to that particular work insurance, but um, is it as simple as just putting yes, I have work coverage, and yes, we'll be losing it, even though they'll be dropping it willingly? That could work too. I would call anyway just to make sure your I's are dotted and T's are crossed. Sometimes there is really good advice around if the application is letting you do the thing you want to do, let it do that and don't fight it, and it just gives you what you need. We often as a sisters unfortunately find ourselves in a position of knowing what it's supposed to do, such as in this case, and it's not doing it. So yeah, sometimes we will end up doing workarounds, things like that. And I will say usually the effect matters more than exactly how you got there, because you know how the application is supposed to work, and you know what's going to get followed up on, and you know that consumers not trying to commit fraud, anything like that. I would still call just to be sure, because it's a pretty painless phone call. The wait times aren't going to be super long outside of open enrollment. But the other way you suggested might work as well. But yeah, it's yeah, it like you said, I think the point you started from, it should trigger automatically. And by that point as an assistant, you probably submitted it 3 or 4 different times. And we've all encountered those issues as well. and I can actually turn that into kind of a blanket statement. Yes, we have all encountered issues where the application isn't doing the thing it's supposed to. And sometimes that means we have to pick up the phone and call and get somebody on the line who we can explain it to who does. There's a really good segue here for the current slide. Successfully accessing the uncommon steps, uncommon special enrollment periods. A lot of these have to be triggered by calling, right? And you have to attest the corresponding situation. Some of them go further and to require an appeal. I haven't had to do an appeal for misrepresentation in a while. I think it's honestly a scary testament to how common they're becoming. And when you have somebody at the marketplace saying, "Yeah, 70% of the calls I have involved this element," it's a little disheartening. But I want to say, pro tip, uh, similarly to when you know what the application is supposed to be doing, if you call and the marketplace representative isn't giving you the answer that you know is correct, you can hang up, call back, and talk to somebody else. So you can go through the rigmarole of escalating, getting a tier two specialist. Sometimes that's totally fine. Sometimes you just need to hang up and call again because the range of help you can get, it's very similar to well, applying for anything. I mean, Medicaid has a little bit of this too, but marketplace you get a real range. It could be somebody's third day of work, or they could be a supervisor. And the people with the most experience typically have the easiest time getting you what you need. But trust your knowledge, trust your knowledge from your training, trust your knowledge that you pick up during this presentation, and know that you probably, if you think you know the right answer, you probably do. And if it's an attestation thing, then it's probably something that the person on the phone can do, and you just need the right person. Um, Excuse me, again, I've been sick. I'm just gonna blow my nose real quick, so bear with me just a sec. Okay, and we're back, and nobody had to see that. Good. All right. Uh, Someone unmute. I thought I heard someone unmute for a second, which is totally fine. Okay. We will press on. So just wanted to summarize because we talked about this a little bit at the beginning, and then we covered a lot of different special enrollment periods. I don't want to lose this particular point. SEPs that don't require prior coverage. This is a short list that you can, put next to your desk. You can have these handy. So there's a low income special enrollment period for households below 150% FPL. You're going to maybe see that again as people fluctuate around that income range. Birth, adoption, placement for adoption. So typically the one you're going to see here is birth, where, okay, we've got a new member of the household. We can get that coverage to go back and cover that member of the family. Gaining an eligible immigration status. Oftentimes the person wouldn't have had prior coverage prior to that. The American Indian or Alaska Native. We talked about how generous the gate is for that particular special enrollment period. Being determined ineligible for Medicaid is kind of a broad one that kind of typically is associated directly with and applied during open enrollment is probably what that should say. And then error, misrepresentation, inaction, misconduct. We spent a while talking about that. The reason that those don't require prior coverage is because if that situation had gone differently, they probably would have had a very different coverage situation. Oftentimes, especially when it was those short-term limited duration plans or a fraud product that wasn't even marketplace coverage, that's what the person ended up with instead of the coverage they should have had. And then exceptional circumstances comes uncommon situations where somebody couldn't have applied. They missed a special enrollment period because they couldn't have applied. Or same thing with natural disasters. These don't require prior coverage. You can, see them in different combinations, and attestation will usually do it. But again, I encourage this network of people who do this great work to talk about their experiences. Already, the Wisconsin, our kind of Navigator Collaborative does a really great job saying this is what we're seeing, these are the trends, this is the problem. Or the application isn't doing this correctly. I don't know why, and then if other people can recreate it. So by all means, please, please, please share your experiences. on this call, after this call. It's going to be really informative and educate your fellow sisters, which is going to help a lot of people in the long run because you don't encounter it, you don't know it until you have to deal with it and you see it and it works. Um, and so as you're thinking of that and going, well, that's a barrier. When a consumer hits that barrier without an assister, without a navigator, CAC agent, um, that could be it. I mean, it's something that we will, bang our head against the wall until it breaks and we get them the special enrollment period. But for a consumer, they might not end up getting coverage because of some of these things. So we're going to look at a special enrollment period. In this part, I'm going to encourage people to be as interactive as possible. I'm going to set up a scenario that is very reminiscent of one I had in real life, and we'll ask a couple questions about it, and then we'll see what people think. All right, so I'm going to see if we can apply some of the things we've learned here. So we have Shelly, who is a consumer. She comes to you for help on December 21st, 2024. So we're in the middle of open enrollment, but she missed the December 15th deadline. She's a substitute teacher who made about 26,000 in 2024, but she kind of has a good handle on her income and expects to make less, about 22,000 for this year. You quickly realize when you go to do the application that she had at some point in the past year been fraudulently enrolled. She was on a plan she didn't recognize. Things were really a mess when you open up that application. In fact, you realize that her son, who's not even in her tax household, has been added to the application and was made head of household. So now there's a technical error on the application as well. You can't even enroll her on the website. You have to call. So she couldn't enroll on her own even if she wanted to. So my question for you guys first, can you get coverage for Shelly that starts January 1st? So you can throw in some no's, some yeses, no's, maybe just one into the chat or Elizabeth says yes. I got some people saying yes. Okay, good. Well, yes, you darn well better be able to. And I will say this is very similar to a situation that I encountered in real life. And she actually reached out to me before December 15th. And I was so confident that I could get her a special enrollment period that I took that appointment slot and I made it for somebody who needed the deadline real bad. So there's a lot going on here, which actually leads me to my next question. How many different special enrollment periods do people see here? Of what I've described, how many different steps of what we've talked about do you see? I see some threes, I see some twos, mostly threes. Okay. I'll say one thing I will say. This is what for me, I find this a fun thought experiment. But remember, you only need one. Remember that you only need one. That's the most important thing. So the answer, as I'm thinking of it, as presented here, you have three because you have the fraudulent enrollment, you have the technical issue, and then you have the income drop, right? So the income numbers, whether you're really savvy with your FPL numbers, that would have dropped below 150, and you could have seen that one as well. That's the three I had in mind. Now, I will say what I told the consumer at the time actually was there's actually one more here. Trolling and steps. There's one more here in that I laid all this out for her. I was like, don't worry, you're going to get a special enrollment period. Don't worry about December 15th. We got this. And I said, and you know what? I'm an sister. And if I'm wrong, that's another special enrollment period. Because guess what? I made a mistake. That's four. So she was going to get a special enrollment period either way. So just know that, somebody can present. You only need one, but sometimes you get these really interesting situations. And we did get her coverage, and she actually in real life had a surgery she needed on like January 2nd. So that's why the importance of the date. And just remembering that and keeping that in mind, those start dates are super important because people there's a reason they come to us. There's a reason they're thinking about their health and their health insurance, and oftentimes it's because they have medication and service and surgery and things like that coming up. Okay, that was fun. That went well. I'm glad. So a few other considerations that I have to share with y'all today. So mid-month, consumers who are going to lose coverage mid-month should act before the first day of that month. So for example, if you know someone's going to lose coverage February 13th, ideally, they found you as an enrollment sister or acted on their own before the start of this month, because then they could get coverage like any most of the other special enrollment periods we talked about, starting for February 1st. Now, it's rare, but I'll say it does happen. I mean, I've seen plenty of people. I think I see some every year that have these weird end dates. I think I wish it would become a little less common because I like things to be nice and clean at the end of the month. Um, but say their coverage is ending February 13th, ending next week. You can go ahead and enroll them in a special enrollment period, and their coverage would begin February 1st. But just knowing, really importantly, that that period of overlap, that kind of dual enrollment, and it's probably employer-sponsored coverage, or maybe through a partner, something like that, it won't impact their APTCs or their cost sharing reductions. So they can enroll in a new plan later in February. Their coverage will begin March. If they wait to do it in February, they won't get a backdate on this. Not as written anyway. There are, if there's something weird that happened, maybe there could be, but most cases don't count on marketplace backdating for you. It's just not what it's designed for, unless you're talking about a birth. And then in those situations of fraud, sometimes you can get it to happen, or an appeal where something got really messed up. But the worst thing about those situations where you can get it to backdate if you have to do an appeal is that it takes a while to fix. It just takes a while. Like, yes, you know the answer. Yes, you're going to win the appeal, but it can take a long time, and the consumer's got to be willing to hang in there for you, even if you're doing all the work. Want to talk a little bit about Cobra. Had a really interesting, or what I thought was a really interesting example come through about Cobra the other day. Consumer elects to take Cobra. Um, they won't be eligible if they end that Cobra voluntarily later in the year. But there's a couple caveats for that that are super duper important. So a lot of times, just a shocking number of times, we see a situation where a consumer takes Cobra, um, but they're figuring out what their options are. Maybe they take Cobra and start paying full price for it, but they're still in their window for taking Cobra. They're still in the original window of losing the insurance. So they may have elected Cobra, but they're still in that 60 days of losing that employer sponsored coverage. So that they can still use that original special enrollment period. Really, really important. We see that all the time. Or then the consumer can go, wow, this is way more expensive than I thought. I really need a marketplace plan. And then you can still go ahead and do that because you're using the existing special enrollment period, the original one. Now, when the employer stops paying their portion of Cobra, so say somebody is terminated, they have a severance agreement, and the employer's paying, 60% or 70%, or maybe they're paying all of it for a while, even though they're no longer working. And then the employer stops because that's the end of the agreement. The consumer will be eligible for a step through the marketplace. And this is one where I actually, the language on the marketplace on healthcare.gov has actually gotten a lot better just to describe this. I think this spells it out very nicely. And I was very pleased when I was putting this together and saw that they said the former employer stopped contributing to Cobra coverage. The person had to pay full cost. That is a really clear description of what happened for a question that we get a lot. So I really think that, again, this is just call it healthcare.gov. I really think they're doing a nice job with some of the information and making it clear. So looking at Cobra and how it interacts with other special enrollment periods, kind of like we just did, where the person was able to take advantage of their original special enrollment period. This is going to get a little hypothetical on us. And by all means, if somebody thinks I'm too far outside the box, let me know. But if somebody who did elect Cobra then loses income and they drop below 150% of poverty level, or they went below 100% FPL but didn't take Medicaid, but then gets income to make them eligible for tax credits, or moves. And moves is the example that came through our listserv the other day that I thought was really interesting. And it really made me think. I was like, I think I should probably put this in this training. Because all of those situations, technically speaking, the consumer has a separate special enrollment period they should be able to use, and they have minimum essential coverage. So there's really nothing stopping them from going to the marketplace and using those tax credits. And then they could voluntarily end that Cobra. So I am putting that out there kind of as a thought experiment. I think those should work. if I have navigators on here who's like, Adam, you've been not mating with no consumers, you're insane, don't do that. Please jump in, correct me if I'm wrong. I invite you to, but I think that should work. The moving one was the question that we got. I was like, I think it should work. So by all means, that kind of comes with another broader piece of advice when you're dealing with special enrollment periods and trying to help consumer. Try stuff. Don't be afraid to try stuff. If you see the situation and it makes sense to you, you're not committing fraud. You think this is what it is. This looks like a bad actor, misrepresentation. This person was incapacitated. Whatever. All the things we talked about today. Try it. Especially if they'll take a verbal attestation, or you can get the marketplace application to do what you want. All right. So chunk plans on the coverage. We don't need to go into too much detail on this. This is just letting people know that this short-term limited duration plans, man, this used to be a much more prominent part of the presentation. Now fraud looks a little bit different, but there are still these plans that get marketed like health insurance. They don't count as minimum essential coverage, so losing them won't work in terms of saying, hey, I lost minimum essential coverage, but how they got that coverage does matter. So sometimes people end up with these plans because of fraud or misrepresentation, like we talked about, and then can attest to those circumstances, and then they could get a special enrollment period. So a note on verification. Verification may require proof. People can usually pick a plan prior to submitting the proof, but their enrollment is still pending until the SEP eligibility is verified. So make sure you get that in as soon as possible. And then sometimes there'll be a data matching or technical issue with the application. The special enrollment period will usually be allowed after verification is complete, or should be allowed after the verification is complete. I think we've seen some more issues with this the last year or so. I can't forget who, and if they're on, by all means, jump in. Where somebody was like, "Hey, I did this," and then it didn't trigger the special enrollment period. It was, oh man, was it Julie? I know Julie is not on, but right after open enrollment, the person should have gotten a special enrollment period, and the site should have recognized it, but they didn't get it. So that's how it should work. If it doesn't, remember to pick up the phone and call the marketplace until you get the answer you need. Uh, just a note on Medicare. Not necessarily super specific to special enrollment periods, but it does come up and it is relevant for this group. Um, when the primary applicant is becoming eligible for Medicare, just remember that ending the marketplace coverage can be tricky. So remember to end it on the last day of the month that Medicare, the last day of the month before Medicare starts. And then when the applicant or the secondary applicant household eligible for Medicare, termination can be set for the future date. And just remember, you can switch the primary. Like the primary applicant is the problem on these. So if you have somebody else in the household that can switch it to secondary, do that ahead of time. Otherwise, there's still, as far as I know, this really tricky timing element to these. So just a note on Medicare. All right. Any questions or discussion, Elizabeth?
Nope.
All right. And we're going to zoom out and talk a little bit about policy. Nothing too crazy, just a few things coming down the pipe right now. All right. So we've got new FPL numbers. I don't know if we've gotten our Covering Wisconsin email out about them yet. I don't think so, but it's coming. So we've got new FPL numbers for 2025. Remember that a lot of times when we look at the marketplace, we're looking still using last year's. So just keep that in mind. And then also the HHS Notice of Benefit and Payment Parameters was published on January 13th. Those are really interesting because they have final rules and things like that for the marketplace, things that really affect what we do. I took 3 of the ones that I thought were kind of most relevant for us in our work to share with you today. Preventing unauthorized or marketplace activity amongst agents and brokers. Those of you who may remember, they made it a little bit more difficult for agents and brokers, these bad ones out there, to enroll people by making them have to call and verify when they update the application. This rule looks like it's going to make it even easier for the marketplace to kind of block them and make them no longer able to access the marketplace to do this, or certainly to benefit from it. So really a good thing that's in there. I'm happy to say it was interesting to see how it plays out, especially when we have so many, operating outside of state lines, outside of Wisconsin. So just continue to, when you access these special enrollment periods that we talked about, continue to report these bad actors as well, to healthcare.gov. The call center people could be great about this, as well as OCI here in the state. There was a note in there on addressing CSR loading, which we think of, or you might not have heard it in a while, but it's called silver loading, where they'll increase dramatically the price of a silver plan in an area to increase the tax credit for that county, and then it in turn will make gold plans like not just gold, but gold plans will look really cheap because somebody has inflated their silver plan prices to make these huge tax credits. I've had different feelings about this over the years. I remember being shocked the first time I saw it, or the first time I had to explain it to a consumer when I was going, yeah, that's why the gold plan is cheaper than the silver. It doesn't make sense because it is a hard concept to explain. Now I see it a lot in Dane County, a little bit less so other places, though you may have your own experiences. Um, but the paragraph on it in the notice of benefit and payment parameters was not substantial enough, at least for me. It didn't say how they're addressing them, in my opinion. So we may see less silver loading or in the future, next open enrollment period, but it didn't really, for me anyway, satisfy my curiosity as to how they're going to accomplish that. And then one other piece that was in there was extending consumer notification requirements to 2 tax years for failure to reconcile. So just giving consumers more time or at least more notice when they have failed to reconcile. I am not yet certain if that will translate into being able to access tax credits longer. I've always found it kind of an interesting scenario where the marketplace eventually catches up to a consumer, and it seemed to me historically to be about 2 years anyway. So this might just be formalizing the process to give them a little bit more breathing room. I don't know yet, but they're going to give consumers kind of 2 years notice around their failure to reconcile. So we might see that. I think we don't see it with our returning consumers because we, as the sisters, obviously do an excellent job explaining to people that they need to file and reconcile their taxes. But sometimes we will see a consumer come to us who has not reconciled, and they'll start getting notices, and it seems like now they'll get them after 2 years. And then our Covering Wisconsin special enrollment fact sheet has been updated. The English version is available now. It's on our website. Spanish is coming soon. We'll be updating our how-to sheets with the new FPL numbers. Those are on covering.wi.org/learn. Hopefully you guys know that by heart. And you can sign up for all of our listserv emails as well. And I know whatever way we sent out the announcement about this, I got some people interested in signing up for those. So this is that piece of information right here. If you want to sign up for a listserv to make sure you don't miss any of these, by all means, that is that link. And then that is all the full content I have for y'all today. But I am really interested and hoping to hear from everybody and have a discussion. There's Unicat. Unicat is back here. I'm kind of bookending the presentation here. Unicat is what put the special and special enrollment, by the way, in case you guys were wondering. It's all about Unicat. But I'm curious to hear from you all, kind of your special enrollment tips and tricks. I'm considering any barriers you've encountered, whether you overcame them or not, any luck with a marketplace representative, maybe an uncommon special enrollment period that I didn't even talk about today, something that you used and it was really unique and you think others should hear about, or any tips for verification and things like that. So what I'm going to do is think what we'll do is we're going to go ahead and cut the recording here so we have a nice tight presentation that we can go ahead and send out to folks. And then we'll open it up for discussion and we'll call that the benefit for the people who are on here live today. All right.